Do you want to be pain-free? We have 5 tips for you to do by yourself that could relieve your pain right away.
But that's not all. Be sure to stay tuned until the very end, because you're going to hear just how simple and straightforward it will be for you to manage and control your pain effectively. And you'll definitely feel much better and more comfortable afterwards. The first 3 tips will help you understand what you can do. Nevertheless, the last 2 tips are intended to help you swiftly eliminate or greatly improve the discomfort of your pain.
Let's start with tip number 1. This is actually the most important of all regarding the psyche. Most people are afraid of their pain because they think something is broken, that they need to have it examined to find out what's torn, where the osteoarthritis is, or whatever else might be wrong. But over the last 35 plus years, during which we have studied this together with thousands of patients, it has become clear that the changes occurring in the body structure, injuries and damages in the majority of cases, do not contribute to the experience of pain at all. So, there's really no need to be fearful of any potential damage that might exist or could occur, because based on our experience, the sources of pain are often due to excessive tension found in the muscles and fascia. And then it's like a kind of cry for help from the body when it sends pain signals to ensure nothing gets out of control or overstrained. When something hurts, which is usually seen as something negative, you're afraid of it, but in reality it's the body's language for communicating to us that something's not quite right, so you should change something. And we know what to change, which is the excessive tension in muscles and fascia. And the fascinating thing is, if you can embrace this understanding, it may calm and relax you so much that perhaps even just by contemplating this idea, your pain might actually improve noticeably. In summary, the pain mostly comes from excessive tension in the muscles and fascia. Lowering this tension, most of the pain is gone or much better.
Tip number 2, why you should not take painkillers. Because painkillers disrupt the way your body communicates what you should do about these pains, or why they're there in the first place. Just fall silent. That is certainly not what you want. We all know that pain has a reason for being, and you have the ability to actively address it yourself. Of course, exceptions are when you want to go somewhere and you're in pain, or you have a headache or back pain or something like that. No problem at all. You can definitely take them. However, as a long-term solution for ongoing or persistent pain, we truly believe that painkillers are not the best option. Tip number 3, the surgeries. In the musculoskeletal system, surgeries are usually not the solution. Studies clearly demonstrate that around 80% is excessive, particularly when it comes to joints, knees,
hips.
When it comes to discs and so on, there's far too much surgery being done. The reason for this is actually quite obvious because the operations didn't eliminate the cause. And then it also becomes clearer why after half a year or 3/4 of a year, the pain, which might have been less after the surgery due to anesthesia, often returns. It starts to resurface again, of course, because the same tensions have built up once more, as our everyday life hasn't really changed much. You see?
You've gained a lot of knowledge about pain's background and why there's no need to fear it. Now, we'll discuss the last 2 crucial points. Tip 4 highlights embracing the advantages of warmth. Warm up the area that hurts. If your elbow joint is hurting, then include the forearm and the upper arm. Take a shower over the affected area. Alternatively, you may wrap some nice, soothingly hot towels around it.
It's also called a wrap.
Or compresses, yes, translated into naturopathic terms. They bring warmth into the system. And this is also a good test for you to further reduce your fear, because in most cases, this warmth will ensure that the pain decreases or disappears completely. Why? Because the excessive tension of the muscles and fascia is practically reduced by the warmth, allowing the entire system to relax comfortably. The effect is immediately understandable and, above all, directly noticeable. Tip number 5 is indeed the ultimate solution, which are the exercises. Let's take a brief moment to recall what we mentioned initially. Why do most types of pain happen? It's because we don't move enough and we fail to use our full range of mobility. That causes the shortening, that causes the excessive tensions, and that's the reason. And the natural solution to this cause is to restore what has been shortened by our daily routines back to a normal length so that the muscles, which are almost no longer supple, yield well, keeping tension normal so joints work optimally and the spine functions properly. What do these exercises specifically involve? They focus on properly stretching and effectively lengthening areas that have become too short. The stretching exercises ease and release the built-up tension that's become way too high. There's strength training included as well to ensure that movements within the body can be effectively and precisely controlled. And this entire package of stretching ensures that we address the root cause and, through 10 to 15 minutes of daily practice, give the body back what is missing from movement in our daily routines, so it can always stay pain-free, feel more relaxed, and move freely.
That's why it'd be truly wonderful if you could go ahead and share this video, as it helps those in pain find ways to effectively help themselves too.